You're watching Public Report, a public affairs presentation of KTBW. The opinions expressed in this program do not necessarily reflect the views of the Trinity Broadcasting Network.
Good morning and welcome to Public Report. I'm Cameron Johnson. Today we're talking about heart health. What are the ways that you can get your heart healthy and how can you manage and maintain a healthy heart? We're here with Dr. Rosemary Peterson. She's the medical director of the St. Joseph Heart Failure Clinic, and with Tina Blackett, the Go Red for Women ambassador. Thank you both for being here with us.
Thank you for having us.
I read that in a 2009 American Heart Association survey that a woman suffers a heart attack every 90 seconds. That's huge. And some of the myths might be that heart attacks are more prevalent in men than women, but that might not be the case. Does this reflect an increase of heart disease in women?
I think there's probably been, over the past several decades, an increase, but it also, I think we're diagnosing it a little bit more. And we're, as women came into the workplace over the past several decades, and they developed the stress, the high blood pressure. Many started smoking when cigarettes became very popular, and that added to it. And America became more obese, and they developed diabetes, and that increased everything.
Mm-hmm. What exactly is a heart attack?
Well, a heart attack, technically speaking, is a blood vessel that you have that becomes blocked over time, and a plaque made of clotting factors, cholesterol, plaque from smoking, different things, just suddenly ruptures and forms basically a dam. And blood can't get through to the heart muscle, and the muscle starts to die.
Okay. And Tina, you have a personal story with heart attack.
I do. I actually suffered a very severe heart attack about 2 years ago. Happened while I was at work. I work for Franciscan Health System. I'm very thankful that it happened at work. I was in the right place at the right time. My symptoms were very movie dramatic, very immediate, very urgent. So it was quite convenient that I was at work and moved very quickly up to the emergency room and then, of course, to the cath lab or the Heart and Vascular Center for life-saving treatment.
Mm-hmm. And you talk about a little bit about those symptoms. What are the symptoms of a heart attack?
I think they can differ from patient to patient, and I'll certainly ask Dr. Peterson to speak about that. For me, for probably 2 years prior to the heart attack, I had a constant pain between my shoulder blades and my upper back.
I think that's just muscle tension.
Right, it was actually treated with physical therapy, steroid injections, your typical kind of treatments, but, the fact that I had a very strong family history of heart disease, and that my lifestyle probably wasn't as good as it could have been, to me, were really big indicators that we probably needed to at least do some diagnostic testing. Some testing was done, but I was living under the impression that somehow that heart attack gene had missed me.
Oh. So a little bit of the ache in the shoulders. What else are the risk factors?
This is actually not an uncommon presentation. It's more common. Women can have symptoms that are typical for men. Unfortunately, I think TV has sensationalized things, and you think of some big man clutching his chest, with everybody pounding on him. And that's not necessarily true. In fact, most people don't have pain, and some people are very concrete, and they say, no pain, and then they won't tell you what they had. But I usually have to, there's discomfort anywhere. And so many women will have chest discomfort, but they will have symptoms like Tina did in the back, shoulders. Some women will describe a toothache quality that just persists or comes on with exertion. And a lot of times shortness of breath and incredible fatigue. And prior to the show, Tina was sharing with me that she had had the most terrible fatigue going on for several months.
Yes, and actually the day of the heart attack, people had mentioned to me at work, you look terrible, your color's off, what is wrong? And that morning, I really almost decided not to go to work, but I knew I had commitments that I couldn't reschedule. I was short-staffed, the typical story. very thankful that I did go to work. But it was exhaustion, not just simply being tired. I mean, we all get tired. This was something very different, where it really was a struggle to get out of bed and get ready to go to work. So.
Okay, so a struggle with fatigue, maybe some aches and pains, discomfort. Why is there some sort of confusion in identifying what might be a heart attack symptom?
Well, many times, and we see this sometimes in men, more diabetic men also, you know, that don't have the typical symptoms. Because fatigue can be attributed to fatigue. You know, your thyroid not sleeping, you know, bad habits, you know, things like that, and other symptoms like Tina was treated with, you know, for musculoskeletal pain with injections and different things like that. I think education is a problem, and there's a bit of denial in everybody. That you just don't want to think it's happening to you.
Right.
Definitely.
So then what do you do when these symptoms are present?
Well, I think when you have the luxury of time and you're not coming in on fire, you know, you get these symptoms checked out. And I think it's really, really important that you do, and you don't think in your head, which I see a lot, you know, oh, well, they're going to make fun of me because they're going to think I'm silly, or they're going to think I'm over-exaggerating, or that I'm a hypochondriac, because it's better to know and be told it's, you know, everything's okay, everything checked out, than when it's too late. And unfortunately, I have to tell people a lot of times it's too late.
Oh, really? More often than not?
More often than not. But I think people are becoming a little bit more aware, and I think this would really help.
Yes, yes.
So how can women be better prepared in recognizing heart attack symptoms?
Well, one of the missions for the Go Red for Women movement is really to get out and speak to audiences, primarily women. Probably 95% of the folks in the audience are women, so that we can raise awareness around the symptoms that relate to heart disease or heart attack. Many of our ambassadors, there's about 25 of us currently, suffered symptoms, and some very severe symptoms, for days before they looked for some medical help. And when we're amazed and we ask, why did you wait? The answer more often than not is, well, I had to take the kids to soccer practice, or, you know, I just really couldn't fit going to the doctor into my schedule. And of course, at some point, they wind up in the emergency room. Either way, and with heart muscle, time equals damage. So,
busy lives, people just need to get in there and maintain their health.
Yeah.
What is the overall goal of the Go Red for Women campaign?
It's very simple, simply to raise awareness, both for women and for health care providers. Heart attack in women has not been widely studied or widely recognized by the general public, and sometimes by primary care providers. So that's one of our goals, is simply to raise awareness, to reach out to other women and say, you know, this can happen to you.
Right. And the same survey that I talked about earlier, another section of it that noted was that only half of the women that they surveyed said that they would call 911 if they thought they were having a heart attack.
That's true.
Why do you think that women are reluctant in calling 911?
I think it's very similar to what Tina said, and I've had a couple of very classic stories that I was in disbelief about. And one of them was somebody that knew. It wasn't like she wasn't unaware. She knew she was having her symptoms. And, but she had to take the kids to soccer. She had an important meeting. Her husband was busy at a meeting. Then she had to bake cookies for the PTA, and then she had to pick them up back from soccer. And it was finally in the evening when she felt terrible. So at 2 in the morning, I get a phone call. This started happening at 9 in the morning. And I said, what happened? And then I've had other women that have delayed calling 911 because they had to clean their house before 911. They didn't want the paramedics to see the mess. So.
And I think one of the messages, too, for women is really, we're such caretakers. We're natural nurturers. And the big message really is, if you're not taking care of yourself and you're experiencing symptoms and you don't get help, you may not be there to be that caretaker. So.
When in doubt, check it out. Call 911.
That's right. Absolutely.
Always.
Yeah.
It's better to be safe than sorry. It's what they usually say.
Yes, certainly.
Absolutely. You can always be told it's your stomach. You know, you can make a future appointment with your gastroenterologist or it's something else. I mean, this is really time is muscle.
And that's what they're there for. So take advantage. Why is it that women having a heart attack might wait longer to seek help than men do?
I think there's a lot of reasons. Number one is probably denial. you know, or maybe lack of education around the symptoms. You know, I think there's probably 100 different reasons.
There's a lot of people that tell me part of it, they don't want to be, you know, to get there and be told everything's okay. And I said, well, you know, it's better that way. The other thing I think is there is a lot of denial. It can't happen to me. It's happened to my father, my brother, my husband. It can't happen to me. You know, there's a lot of denial in that.
Is it important to know your family history?
Oh, yes.
Yes, definitely.
That plays a huge part, unfortunately.
Yeah.
Unfortunately, you can't change that.
Right.
But that should actually, if you have a very strong family history, it should give you a special onus to just really, you know, make your other risk factors pristine.
So know the risks, know your body. When you're experiencing symptoms, don't be afraid to call 911, go into the doctor, check it out.
Yes, and I would encourage people to dial 911 because of the life-saving treatment that they can offer immediately.
And not to drive
Right.
to the emergency
Right.
room yourself.
Right.
Because if you
they're
don't
on
care
their way
so
to
much about
soccer and-
yourself,
Yeah.
you may kill somebody on the road. So that's really important.
Yes. Yeah, and you know, fortunately, as I mentioned, I had this heart attack while I was at work in a hospital, but it was at about 10 after 4. I typically go home at 4, but I decided to stay and work late. There's a very good possibility that I would have been driving home and you know, God forbid that something would have happened to somebody else as I was driving and this heart attack occurred. So really important to dial 911. Make sure that other people are aware of your symptoms as well.
Before we take a break, let's get into the solution of this problem. What are some of the lifestyle changes that all adults can take to help hopefully prevent heart attacks?
Well, like I said, there's several risk factors, and a couple you can't change. You can't change your parents, you know. You can't change your race. There's some races and, you know, that basically Hispanics, African Americans tend to have a higher risk. You can't change that you're aging. You can try, but you can't change that. But then there's the things, can you stop smoking? Yes. Can you change your lifestyle and become more active? Yes. Diabetes has been on the increase in this country where even kids are developing it these days, and you know, it's a typical thing of for 99 cents you can supersize me and triple the size of your meal, and that's really contributing to that. So all those things you can change just by daily stuff. Then knowing your numbers, your cholesterol numbers, that's a simple blood test. Knowing what your blood pressure is, and getting it treated if it's elevated.
And where can people go to find more information on all of this?
Franciscan Health System actually offers a website. It's fhsheart.org. You can go there and you can get an awful lot of information about the Make the Call, Don't Miss the Beat 911 campaign, as well as an evaluation of risk factors that's given to an RN that actually works in Dr. Peterson's clinic, and they can contact you to make an appointment and come on in.
So go online, know your risk factors, know your body, know the symptoms, and try to make those lifestyle changes that might make a difference in help preventing heart attacks.
Absolutely.
Well, thank you so much for talking about heart attacks with us. We're going to take a quick break,
Great.
and then we'll come back and we'll talk a little bit more about heart failure and heart health.
Wonderful.
And thank you for watching Public Report. We'll be right back after these messages. Please stay tuned.